Let's talk about bladder 26, gate of origin shoe, a back transporting point. Bladder 26 is located 1.5 tun lateral to the posterior midline on the level of the lower border of the spinous process of the fifth lumbar vertebra. How to find bladder 26? For orientation in the lumbar region, first, determine the Toffler's line. Place both hands directly superior or lateral to the highest points of the iliac crests, joining the thumbs on the midline at the lumbar spine. In most cases, this line intersects with the spinous process of lumbar 4. This varies depending on the patient's position. Next, locate the lower border of the spinous process of L5, and on this level, locate bladder 26, 1.5 tun in a lateral direction. Located on the same level are extra point B8 or buttocks 8 on the midline and a point of extra buttocks 2.5 tun lateral to the midline. Needling bladder 26 is done vertically 0.5 to 1.5 tun. Actions or indications: strengthens the back, especially for kidney deficiency syndromes. Regulates the lower burner. Bladder 26 is very frequently used as a local point in chronic lower backache and should always be used if tender on pressure. Bladder 26 is the most effective point for lower backache, both bilateral and unilateral, and it is nearly always tender on pressure. It is very close to the sacroiliac joint, often involved in lower backache. Use bladder 26 nearly always in conjunction with bladder 23 and with the extra point, Shi Chi Shui Sha, which is on the governing vessel below the tip of lumbar 5. In summary, bladder 26 strengthens lower back, so good for lower back ache, sciatica, pain in the buttocks, weakness or stiffness of the lower back, difficulty in bending the back, moves chi and blood in the lower burner, so for abdominal distension and pain, abdominal masses, benefits urination, for enuresis, frequent urination, difficult urination. Bladder 26, due to its proximity to the fifth lumbar vertebra, is much used in the treatment of lumbar pain. Various classics of Chinese medicine have specified the use of bladder 26 in the treatment of wind taxation lumbar pain, that is, lumbar pain due to attack and injury by exterior pathogenic factors which lodge in the back and over time lead to deficiency. This is a common development of back pain due to painful obstruction and reflects the fact that not only can kidney deficiency lead to weakness of the back and hence invasion of exterior pathogens, but also that prolonged retention of pathogenic factors, especially when the bones are injured, can weaken the kidneys. Thus, standards of patterns and treatments said in backache, wind, damp, cold, heat, sprain, blood stasis, chi stagnation, accumulations are all the manifestation. The root is always kidney deficiency. The essential question stated in chronic bone painful obstruction, where the pathogenic factor repeatedly attacks, it will reach and reside in the kidneys. The action of bladder 26 on the lumbar pain is so valuable that in clinical practice, it may be used for any pattern, not solely deficiency. And it is one of the points that should be palpated and needled if tender in all cases of backache. Tonifying action of bladder 26 is implied in its name, gate of origin shoe. It is further indicated for deficiency disorders like wasting and thirsting disorder, deficiency distension, diarrhea, and various urinary disorders, all characterized by deficiency of the kidneys. This is an area that contains several gate points. Traversing the front of the body, REN 4 and 5 are first gate and stone gate, respectively. 2-4 is gate of life. Origin pass, an alternative name for bladder 26, reminds one of the nature of the energetic work of this area. First gate on the bladder meridian negotiates the territory between the sacrum and the lumbar vertebrae. As any hinge or gate, it needs to move freely within its designated territory, otherwise stagnation and blockage occurs. First gate can free up this gate in this fundamental energetic region and, as its name implies, accesses a deep level of chi with which to tonify the area. Bladder 26 strengthens the lower back, removes obstructions from the channel. It's good for problems of the lower jaw, like frequent urination, incontinence, abdominal distension, diarrhea. Bladder 26 is local point for chronic low back ache. It is often tender upon palpation and can be needled if tender. Especially good for lumbar pain from external pathogenic attack, which has lodged in the channels of the back. In this sector of the body, again, there are a number of gates. So we have the REN 4, which is first gate, REN 5, stone gate, and on the back, we have this gate. We have this point, above which is 2-4, the gate of life. We use bladder 26 if a patient is stuck at some level and you cannot get through to their core. It opens the gate to the officials and it partially affects all the other gates in the body. Very good for chronic lumbar pain and hemorrhoids.